So, cranial nerve 7 is the facial nerve. It's involved in the facial expression. And it's one of the very useful ways of seeing if a patient has a stroke, because it will allow us to determine if a patient has an upper motor neuron lesion, something to do with the brain, or if they've got a lower motor neuron lesion, something to do with the nerve. If we look here, we can see that the facial nerve comes out and then goes to the areas that it will innervate. So around the eye, around the cheeks, around the lips. There are 5 areas that the facial nerve controls, that being the temporal region, the zygomatic region, the buccal region, the mandibular, and the cervical region. Cranial nerve 7 is very useful in helping identify if a patient has had a stroke when they complain of weakness to one side of the face, because there are 2 major differences here. It has both an upper motor neuron component and a lower motor neuron component.
Before we go any further, I think it might be useful to talk about these 2 terms. A motor neuron is a particular nerve cell that enables you to control your muscles. And there are 2 types of these motor neurons. The lower motor neuron relays the signal from the upper motor neuron to the muscle, allowing you to control your muscles. The upper motor neuron sends signals from your brain down the spinal cord to control the lower motor neuron. For example, to control your right arm, a signal is sent from the motor cortex on the left side of your brain via the upper motor neurons down the spinal cord, where the signal is then picked up by the lower motor neurons, which will interact directly with the muscle, allowing the muscles in your arm to contract and you to move your arm. So let's look at an example here. If you have an upper motor neuron lesion, then the signals from the brain can't get through. As a result, that muscle will show an increase in spasticity, a velocity-dependent increase in muscle tone, which unfortunately greatly hinders the ability for the patient to use that muscle group. That muscle now goes into spasm. This is why people who've unfortunately had a stroke will have no control over the fixed, rigid muscles on the side of the body opposite to the side of the brain where they've had the stroke. This is where they have the upper motor neuron lesion. And by comparison to that, when you have a lower motor neuron lesion, you've cut all communication to that muscle. Thus, all control of the muscle is lost, and that muscle will go lifeless and flaccid instead. A lower motor neuron lesion is essentially what happens when you are given a local anaesthetic. This is particularly seen at the dentist. When people have a local anaesthetic at the dentist, they frequently find they can't speak properly and slur their words whilst it's in effect. The local anaesthetic has given them a temporary lower motor neuron lesion, i.e. it's switched off their nerves and their muscles have gone limp.
So the 5 regions, the temporal, the zygomatic, the buccal, mandibular and cervical, the 4 lower regions are lower motor neurons, i.e. they have control after the nerve has come out onto the face. The temporal region, however, that has control coming in from the brain. If there's a stroke, then the temporal region is bilaterally innervated, so there is an innervation coming from both the left and the right sides of the brain. If there is a stroke, then the other side of the brain will be able to compensate and you'll get forehead sparing.
So when we say forehead sparing, that is literally what we mean. In terms of testing the facial muscles of expression, the first step will be to get the patient to raise their eyebrows up.
Now we're going to have a quick look at the muscles that control your face. So if you could raise your eyebrows up as high as you can, please. Super.
As we can see here, by having an intact cranial nerve 7 on both sides of the face, the lady has been able to contract the temporalis muscle on both sides of the forehead, raising her eyebrows up together. If a patient has had a stroke, even though they will have lost control of one side of their face, then because cranial nerve 7 is bilaterally innervated, the patient will still be able to raise their eyebrows up, as we can see with this gentleman here. In contrast to that, if you have a Bell's palsy, which is a lower motor neuron lesion, i.e. the lesion is affecting cranial nerve 7 after it has left the skull, then the patient will not be able to raise their eyebrows nor make facial expressions on the affected side.
Conversely, if you have the lesion after the nerve has left the face, there is only one source of innervation. Therefore, when there is an infection, such as a Bell's palsy, affecting this nerve, the whole side of the face will lose expression. Let's actually just review what some of that expression is now. So it's going to control the movement of the eyelids and the muscles around the eyes.
As such, the zygomatic branch of cranial nerve 7 is tested by having the patient screw their eyes up and the examiner attempt to open their eyes with his fingers.
It's going to control the muscles of expression around the face and also those of the lips. Hence our examination structure, getting the patient to raise their eyebrows up, screw their eyes tight as they can, where we will try to open them, blow their cheeks out, whereupon we will test the seal at their mouth, and also get them to show us their teeth, which is also confirming that everything's working normally. Now we're going to have a quick look at the muscles that control your face. So if you could raise your eyebrows up as high as you can, please. Super. And screw your eyes tight. Now don't let me open. That's good. If you could show me your teeth. Okay. And blow your cheeks out for me. Super. Cranial nerve 7 also has a taste component providing sensation to the anterior 2/3 of the tongue. However, as a rule of thumb, we don't test that sensation. Another test that is sometimes but rarely done with cranial nerve 7 is the glabella tap. We tap on the patient's forehead and see whether or not it causes them to blink.